Let me immediately give the core answer. There is no non-surgical treatment for prominent ears. I can state this very clearly. Especially, I have seen many alternative treatment methods in patients with ear deformity. The most up-to-date and perhaps the most absurd one is, please viewers, bear with us, using super glue. Meaning adhering the ear backwards using these chemical substances. No matter what you are doing, I implore you, do not attempt this. Adhering the ear using chemical agents, the skin behind the ear in the ear area, can even cause cancerous lesions in the long term. The damage caused by the chemical substance in that area, the irritation it causes, is very serious. Since skin integrity is compromised, it can cause very serious infections. Please do not do this. I specifically request this from you, the patients. Other than that, especially my patients ask, "Doctor, I have a 1-year-old or maybe a 1-month-old baby. Their ears, they have an ear deformity. If we use a headband, I wonder if we can fix it. Can it be fixed while the baby is still soft?" When faced with this, I consistently state that I do not believe a headband will resolve this issue even during the baby or childhood years. But for patients who ask me this, I always say, please try it rather than leaving a question mark about whether it would solve it. We won't operate on a 1-month-old baby for ear deformity anyway. We will operate at the earliest around 6 or 6.5 to 7 years old. Until that time, you can use a headband as much as you want. But you should not hold out too much hope either. Based on my experience, I doubt that using a headband will be effective even during the infancy period. I also learned a very striking and effective method from one of my patients. I saw a method using the plaster bandages from our dressings, making them double-sided tape and sticking them behind the ear like double-sided tape, pulling it back. A technique to pull it back. I actually quite like this. A more logical approach compared to super glues or other chemicals. It's a method that will traumatize the skin less, irritate the skin less. However, ultimately this is also a temporary method. However, it can solve your problem for 1 hour or 2 hours. Ear cosmetic surgery. The term surgery might intimidate you, but I want you to know that it is not a difficult procedure. If we can perform the thread lift technique, it takes about 15 to 20 minutes. If we are performing the surgery with the classic technique, it takes 45 to 50 minutes. Never this using colloquial methods. Don't risk your health, nor put your aesthetic appearance at risk. We can perform this surgery very well, very successfully. Therefore, in every situation, know that the solution for ear deformities, for prominent ear deformity, is not non-surgical. However, I want you to know that these surgeries are also very simple, very easy surgeries.